Okay, so we are about 2 weeks out, and the graft flap, the left paramedian forehead flap, based on the supratrochlear artery, has done very well. So you can see that it's very viable, good capillary refill. Yep, looking good. And the primary defect closed very well, and it was so tight that we couldn't close primarily over here. So I'm going to put a little tiny skin graft to get it together. That's what I'm going to do, and that'll come from the donor area right here. So we'll mark it, flip it over to cover this area, and not all the way, just this up to here, and then some of the skin to cover this area. That's what we'll do. Let's show you the marking and stuff. Good, perfect, you can stop. Okay, so in this we have done, as you can see, that we got this nice and looks pretty good. A little dusky, but that's going to be settling just fine because he did not elevate anything other than just this area, so that's pretty much okay. And then we got the eyebrows to match both sides, just maintaining the horizontal level on both sides, so they look pretty good. And then got the graft from here, put it over here. When you take the specimen, make sure you measure it again and again. Sometimes it shrinks, and that's what happens when you take a second graft to put it right there. So that's the strip of second graft. So that could have been avoided if I measured it even a little longer and before I took the specimen off from here. But overall looks pretty good. We gotta do a little compressor bolster dressing here. We'll put a cotton ball and then pressure dressing with steady strips and mustard salt, and we should be good.